Last update. The other thing that people have been talking about, and once again, this is hope speaking rather than science, really. Yeah, is that there are a lot more cases now, but there aren't as many deaths, and it's going to take a little while to figure this out. But we've heard the same thing said over and over and over again. And then, about a week or two after that particular hot take comes out, then we see the deaths start to rise. And so, yeah, first it always starts out that, well, we don't have the virus. Okay, fine, yeah. And then let's say you have a lot of people that do something that leads to them catching the virus. Okay, great. So then it'll take actually about 7 to 10 days for those people to be sick enough to go and voluntarily get tested, because there are not many places in the US that are actually going out and proactively testing people. And honestly, we don't have the capacity to go out and just test everybody, which is what we kind of need to do to track down exactly where the virus is. So it's mostly people that are voluntarily going for testing, and these are people that think they might be sick or that have been convinced they might have been exposed. For example, yeah, they may be contacts of people who are confirmed positives. And so these people show up for testing, and it takes a couple days to get the test through. And you can't even detect the virus reliably until about a week after the actual point of infection. So that's a delay. You can say, oh, well, we all went out for Memorial Day or something, and nothing happened. Everything's fine a couple days after. It's because you're looking too soon. This is a very, very slow virus, and it goes in stages. So it's about a week to the first people getting sick, week to 10 days. From that point, it's about a week until you start seeing the first hospitalizations coming through, because this is not a virus that's going to knock most people out right away. It's progressive. It gets a little worse day by day in some people, and in other people it gets bad and then it goes back down. And you don't know until you get there exactly what's going to happen in any particular case. So it's just waiting and hoping. Yeah, that's when hope comes in, and that's when hope is actually very helpful. So yeah, after that stage, so you can say, well, cases are rising, but hospitalizations remain very low. And then about a week after that, you say, oh, wow, hospitalizations are high and cases are high, but you know what's low? Yeah, deaths are low. And this is because even after people are in hospital, the virus in some will get better. And thank goodness they're going to make it. In other people, the virus is going to get worse. They're going to try all kinds of treatment to try and slow that virus down. But in some cases, it's not going to be effective. And so then the deaths are going to come in about a week after the hospitalizations start to come in. And so you have all these curves, and they're basically the same curve for the virus. So that's infections, and then shift it over a little bit. That's going to be the time when you start to get the hospitalizations, and then shift that over a bit. That's going to be the time when you start to get the deaths. We're seeing this now in Arizona. They had their cases really spike up about a month ago. And they were saying, well, it's okay. We got cases, but it's because we're testing and everything's fine. Yeah. And then we saw their hospitalization numbers get really bad. I thought they were close to between 70 and 80% ICU beds full, which is, yeah, danger level. Because those ICU beds are not, I mean, the beds may be evenly distributed throughout the state, but the cases are going to be clustered in particular places. And so when you get to that level, it means that some places will have no more ICU beds available, and other places will be sitting empty. And you can't always put, a COVID patient on the bus and ship them to the place where there is a bed. Sometimes you have to find a way to treat them at that spot. Yeah, that's the danger there. And of course, at that time, we were also hearing out of Arizona that, yeah, well, hospitalizations are bad and cases are bad, but deaths aren't bad. And then they hit their record death toll. I think yesterday they probably have surpassed it today. Yeah, just because it takes time for these things to come through. So don't get overconfident. Don't let that particular false hope um, make it feel better. Because right now, the U.S. in general, Texas in particular, a lot of states are going through, I don't know, one of the stages. It's the new stages of grief and recovery, basically, but for COVID. Similar mental things going on. And if you see cases rising, just wait a little bit, and then you will see the hospitalizations due to those cases start to rise. And leave it another week or so, and the deaths are probably going to start coming through. So right now in Texas, we're at the stage where hospitalizations are way up and cases are way up, but we're still taking comfort from the fact that deaths aren't way up. And yeah, I don't want to be the one that says this, but yeah, this is what it is. Deaths are going to start rising. It's probably going to be next week. If statistics from all the other COVID cases around the world hold true, and I don't see why they wouldn't this time, because they also held true in America before, when everybody was going through the first wave or the first big surge in every state. So there we go. Um, yeah, sorry, that's two downers to end your day. Hang on to hope, though. Hope isn't bad. It's just false hope that's bad. And the real stuff, that is precious and valuable, and you want to get that with both hands and hold on to it. We can still dig our way out of this thing. Yeah, we just got to work together. And seems like we can't work together, but there have been other times in American history and human history when it seemed like people couldn't come together, and then they did. And I think it's going to happen at some point. I don't know how. There's a lot of ways that it could happen, but that's where my hope's coming from. So thanks very much. This is Ask Dr. Ben.